the hospitals. Maybe it's going to look different. I don't know. In any case, it's going to be a transition. You guys have barely done any clinical time this semester, right? You guys, we made it to week 7. You had some time with your patients or your residents, and then you were back at home. So we know that the transition for you guys moving from 111 to 112 is going to be way different than anybody else's transition ever has been. So keep that in mind. We know that, guys. We're not having expectations that you guys are going to come with a huge amount of confidence in your skills, but we're here to help you with that. So we're going to leave behind all the great faculty who have prepared you to come to 112, and it's time to move on to what is going on here, Grant?
I forgot to press record, so now I'm recording. So I got.
Oh, all right, okay. So we're leaving 111, and now you guys are moving to 112 with new faculty, new expectations, new classes, new books. Things are not going to be the same as they were for you guys in 111 and how you did things. There will be different expectations, and I'm going to try to share some of those with you guys now. So, all right, slide. Good. So I won't ask you guys because it's too hard when we're doing it via Zoom. You know, what is important for you to take with you from 111 to 112? Well, how you studied, right? How you prepared for exams, your study group, your blood pressure skills, right? All those things that you guys accomplished, and especially those first few weeks, you better bring those forward, because what you learned is the building of a house, right? You learned the foundation. And if you don't bring that forward with you, 112 starts to build the house on top of it. And if you don't bring those things forward, your house is going to crumble. 112 builds on everything you learned in 111. So, for example, on exam 1, 2, 3, whatever, could we ask you questions about some of the meds that you learned in 111? Absolutely. Can we ask you questions about lab values? Yes. Okay, so just making sure that whatever, your suitcase is going to be packed full of whatever you did in 111, and everything is coming forward into 112. Okay, all right, Grant, slide. So how are things different? Let's just start by talking about our schedule. And right now, we're just going to proceed with what our usual schedule is for 112. Everybody has a conference on a Monday. In our conferences on Monday, right now, we don't know how many people are going to be in them, but they're very typically small group, usually about 10 students. So for example, on Monday from 9 to 11, I teach 10 students, and they are typically my clinical students, nobody else's. Okay, Liz will teach hers, Mary will teach hers. I also teach Linda Holmes, the adjunct 10 in the afternoon, and so on. So typically on Monday, our groups are small. Okay, that's our Monday conference. We don't do a lot of skills in 112. We have a first few days of on-campus clinical where we'll do some skills, but mostly our 2-hour conference on Monday is learning diabetes, neoplasm, musculoskeletal disorders. Couple skills in those conferences, but not many. Okay.
And your conferences, unlike this semester, will be with your clinical group. So
exactly.
It's going to be all mixed up.
Yep. Now, there's sometimes, yes,
hey,
question?
Jackie. Yeah, no, it's Arlene. Hey, when you say that, because one of the things we've been reassuring all of them are they do review some skills the first couple of weeks on campus. Can you just explain to them at some point what they are?
It's on my list to do, absolutely. Yep, because I want to make sure when you guys leave this conference or lecture today that you at least feel like, okay, they understand in 112 where we're coming from, what we don't feel good with, and what we really want to practice those first few weeks. So hopefully you'll walk away feeling a little bit less stressed about things. So that's the Monday conference. Everybody has to attend it. There's also another 2-hour conference on Thursday. That conference is usually 20 students. Now, in the fall, we don't know what that's going to look like. The college may very well say you can only teach in groups of 10. So in any case, the groups are still not that large. You will have a 2-hour conference on Thursday then. You also have a 1-hour lecture on Thursday. Our lectures are barely anything like what you guys are used to here. We have a couple lectures that are face-to-face where we're talking about content and disorders. But for the most part, our lectures are the 6 exams we have, because you're going to jump from 4 exams to 6. We do the dosage exam in one of those. We do the HESIs. So we don't have a ton of lecture face-to-face time in the sense of what you've been doing this semester. And that's from 9 until 10. And then either on Tuesday, Wednesday, or Thursday, that will be your clinical day. Everybody has one 9-hour clinical day. We start at 6 a.m. if we are allowed to be at the facilities. Okay, 6 a.m. not 6 p.m., not 8 a.m., 6 a.m. my favorite time of the day. And that will go from 6 until 3. We expect that you're going to arrive a little bit early and get prepared, but we'll talk more about that when you guys start in the fall. You don't have to worry about that. When your schedule comes, though, pay attention to, okay, I'm a Wednesday clinical person. I'm there from 6 to 3, whatever the facility happens to be. Okay. So that's sort of how our calendar looks, a little bit different than what you've been doing this semester. If we have to Zoom, it may look different than what you guys Zoomed this semester. We continued to Zoom face-to-face with all of our classes, and all courses did something a little bit different. So we'll see how that looks in the fall. None of us know how that's going to look. The exam questions may be a little bit different. The expectation will be now that you guys had a lot of questions that were very difficult on your exams. They're going to be starting to climb up a little bit of a mountain now with, here's the information, what are you going to do with it, right? We know that you guys should know what a normal blood pressure is, but what do you do when you find that it's abnormal? Am I going to call the provider? Am I going to get medicine? Right, those kinds of things. So exams may look a little different. Ours are 6 exams, and they are 34 questions apiece. And you have 70 minutes to do them unless you're in accommodations. Okay. Right now on exam days, you will start exams at 8:30 until 9:40. Over the summer, when we know more, we will send you a very long detailed letter with all of that information in it. Let me just write down. We try to give you guys, though, the exam dates early so that you can start planning. Yeah.
Yeah, it's close to every other week.
Yeah, sometimes there's a couple weeks in between, but yeah, it can seem like it's every other week. Yep. Faculty expectations will be no different, I'm sure, than what you had in 111. We very much expect that you will come to class prepared. We don't expect that you will come with a blank nursing guide. We don't expect that you will say you didn't do the reading, because you will be lost and you will do poorly on the exams. And we're going to know who's not prepared. So we will talk more about that with you guys the first couple of weeks of school about how to get prepared. But you can't come to class and not be prepared, because you may be asked, we haven't decided yet, but there's a possibility that we're going to ask you to leave class if you're not prepared, and go get prepared. Okay. You guys, there's a lot of work, and you want to make sure that you come into class already having heard that information once. I'm no expert. I've been teaching for 16 years, but it doesn't make me an expert. When you read the research and what the experts say, you will do way better in class if you read your objectives, read the textbook, or at least skimmed through the textbook, filled in your conference guide with whatever the answers are, looked at all the extra resources we gave you, and then you come to class. Now when you hear me say a word like, I don't know, Herceptin, when we talk about neoplasm, you don't go, oh my gosh, that's like a foreign language, I have no idea what she's talking about. You need to come to class ready to engage, because we get up and we do a lot of work on the boards. The way 112 works is we don't do a lot of teaching. we do a lot of sharing of information back and forth, and you guys do a lot of teaching on your own to other students in the class. So it's going to be a little different if we're back on campus. If we're doing it this way, who knows? All right, Grant, you can go. They're all like saying, I'm staying in 111 now. These people are crazy in 112. Class schedule we talked about. The outline. Guys, our outline will look sort of similar, but it have some differences to 111's. And you guys have to be able to just go with the flow. It's not going to set you up in good standing to come in and say, oh, I hate this outline. I liked 111's better. That's fine. Love what 111 did, but realize this is what you're dealt. Here's what you got to figure out, and let's just do it. Students after a couple weeks will say, okay, I get how your calendar and your outline and things work. But the first couple of weeks, it's change, right? All that change is hard for students. So go with the flow. I do not know at this point if you're going to get a hard copy of the outline. The print shop is closed on campus. We don't know. It may very well be something that's just an electronic document, and we give you a few weeks at a time. As soon as we know, we'll let you guys know. Okay. We have a calendar that might look a little different, but it works for our students. And you will get that. It will be in your part of your outline. I talked to you a little bit about expectations already. Talked to you about exams. And then right now, our tutoring, we are not doing any tutoring right now because we're not on campus, of course. Right now, we basically are just doing office hours. You guys, Grant, do you guys, and Carlene, do you guys still call it tutoring? Is that where you do your skills or not?
No.
Okay. So tutoring for us in the past has been a time where students can come. It's usually offered during our office hours, and you can come to the lecture hall or a classroom, wherever it happens to be, and we review the material that we're working on, but we don't review it. You guys do it. So for example, when we're studying diabetes, if there's 20 of you that show up, I'll give each group of 4 of you a card that says something different. Oh, you have a new diabetic and you have to teach them how to give insulin. So you're going to write down some notes and then you're going to teach the class. So it's just another way for you guys to share and teach, because teaching anything to somebody else is how you retain the most information. Okay. But more of that as we get closer to fall. And then office hours. Oh, that's okay, Grant. Office hours, we try to post on Blackboard, and we will send you the office hours, and we try to do it so that you'll know my office hours, Liz's office hours, and Mary's office hours. And we try to have you see whose ever office hours it is, because they'll know what's going on with you, but you can go see anybody. And we encourage you guys to use whatever you can for office hours.
And their offices are located in the same hallways that 111's offices are. So
yeah,
yeah.
I'm next to Grant, Liz is next to me, and Mary's around the corner from Jenny and Lori and Suzanne's office. So just a couple other things, Grant, before I go on and do a few practice questions, although it might be kind of hard because people will be shouting out answers. One other thing that I think is really important, guys, is I don't know if you saw the email that came out from the college about joining Circle In. Did you guys have a chance to talk about that, Grant and Carlene, with your students?
We didn't really talk about it. They got the email, but we didn't.
Okay.
I asked a few students if they joined it.
Yeah, we did a whole we did a whole PowerPoint on it. I think in 111, especially now, students are still trying to figure out how to study, right?
Yeah.
The students in 112, they already had a full semester on campus with you and half with us. So for some of our students, it worked out really well. But I would encourage you guys, when the semester is done and for the fall, if they offer Circle In, it's an app you can use on your phone or a computer where you can just reach out to other students in your group and say, oh my gosh, it's 10 o'clock the night before the exam. I can't call Judy or Carlene or Grant. I'll be in big trouble, but who's up and who can help me? So it's a way for you guys to have your own study groups, right? Yeah, Grant, like don't call me at 10 o'clock. So let me just, before I again do some of the exam questions that I brought for you guys. Just
And-
share. Oh,
Jackie, I'd like you to explain, they've learned a little bit about prioritization, but could
yeah.
you just go over that a little bit? Because
Yep.
that's the main focus. It's a big switch from
Yeah.
111 to 112.
Yep. I'll try to talk about the expected versus unexpected like we usually do, Grant. So I'll do that in a minute, guys. I just want to talk to you about that clinical time that you're going to have on campus for the first few weeks, because I know that that's where you guys probably have some anxiety. You guys will know theoretically what you know because you prepared, you took exams, you watched your conferences, you did the homework. So you should be coming to us with the knowledge in your mind. Oh, I know how to do an abdominal assessment because you learned that. You should be able to say, I understand the basics behind an IV, right, Grant? You guys still did that this semester?
Yeah.
Yep. I understand it. Oh, sorry, go ahead. Okay, I may not know what to do with one. I know how to do pedal pulses because I learned that, or I know how to do blood pressure, but I haven't had that opportunity to be able to do it since week 7. So you should be coming with that knowledge, right? You know how to give a shot because you learned it. You can say it, but can you really do it at this point? Maybe not. Our expectation for the fall will be that when you come to us for clinical, we have 3 weeks of on-campus clinical. The first week is just orientation. We get you used to the outline and all that sort of stuff. We will also that day practice blood pressure, pulse, respirations, lung assessment, abdominal assessment. And in the past, we've been able to kind of go through it quickly, right? Because students were able to take care of patients in 111. We probably are going to have to back that up a little bit and maybe take it a little slower and give you guys more guidance. And we will certainly be more patient with you because you haven't had those opportunities. However, if you come to us and say, I have no idea what you're talking about with a lung assessment, I don't know. I don't know how to give a shot. I don't know what you mean. You have to still know the information in your head. We don't care if you can do it. We'll have plenty of time to help you get up to speed with your physical skills. But you can't come in that first week and say, I forgot how to do a lung assessment, because that's not going to cut it. Does that make sense, guys? Are they all shaking their heads? Okay, and you guys can ask me questions about that in a little bit. So yeah, the expectation will be we're probably going to have to go through lots of skills that you would have done had you been with your patients all along. We're probably not going to practice enemas. We're probably not going to practice G-tubes or catheterizations. We'll do those as we go along in the hospital. But as we like to call it, the meat and potatoes of what every nurse has to know, and that is physical assessment, vital sign assessment, giving injections, how to assess an IV, basic things, okay? Those other skills will help you with, okay? So the first couple weeks we're on campus, and then week 4, we usually are at the hospital. We do a scavenger hunt. We do a tour of the facility. We get you guys onto the electronic medical record, and then we'll actually have you guys go in and see a patient and maybe do an assessment. But by that point, we are super confident that by the time we go to clinical week 4, you guys are going to be feeling much more comfortable than you feel right now. That's our job. You don't have to worry about it. We'll get you there, but you better come with the knowledge that you learned in 111, because that'll just make picking up the equipment and doing the practicing a lot easier. Yeah, Grant, go ahead.
No, I didn't have any.
Oh, all right. Okay. All right, 928. Okay, so again, before we go on to some of these test questions, Grant wanted me to talk to you guys a little bit about the difference between, or how to prioritize. So in fundamentals, we're really kind of looking at the stable patient. That's really kind of what the course description is, right? You learn sort of the stable things. Well, that's great. Not that all your patients in 111 were stable, but that's kind of the foundation. You can't learn how to manage a sick patient who's got problems going on unless you have in your head and, you know, have an understanding of how things normally work with a patient. So when you come to us and through the rest of the courses that you take at MCC in nursing, the big focus is going to be on prioritization. And I don't mean prioritization of I'm giving you 6 patients to take care of. I mean prioritization of how do I know what to attend to first with my patient? What do I do first? What do I do second? Your focus is going to be very different. When you are in 111 and you're new and you are nervous and you can't put a blood pressure cuff on right because you're so anxious, right? All those things that happen to every single one of us. We don't have that time in 112 for those kinds of situations, right? We have to be able to walk into our patient room and say, oh, something's wrong here. They don't look good. They're breathing heavy. Oh my gosh, they're screaming in pain. Oh, their O2 sat is 85. Oh my gosh, they have diarrhea. This. Oh, there's no urine in the bag. Oh, they're vomiting. Their NG tube just came out. All those things. And so how do you know what you have to attend to first? And in 112, we talk about that, but something for you guys to think about sort of over the summer when you're thinking about getting ready for the next semester would be thinking about how would I use, and you, if you have a pencil and you want to write these things down, that's fine. I know Grant's taping it. How do I use Maslow and the hierarchy of needs as I look at my patients, right? How do I think about what do I have to attend to first for my patient, right? They're sobbing and sobbing because they had a mastectomy and they have breast cancer, and you know, that's the priority for the patient. But yet you go in and you do their O2 set and it's 89. Okay, don't care about your tears right now, right? Of course we do, but we have to attend to what's going to kill them first. That's what I always tell students. What's going to kill my patient first, right? Not her body image or his body image, but an oxygen saturation that's low is going to kill them first. So we have to attend to those things that we know are going to harm a patient the most. For example, if I have a patient who is screaming in pain, and you'll see that next semester, they're so uncomfortable. Their oxygen saturation is 91. You might go, well, I'm going to get them their pain medicine, right? Wrong. Their oxygen saturation is low. It could go lower if I gave them a narcotic. So I have to attend to their oxygen need before I attend to their pain need, because pain doesn't kill them. So how do I use Maslow? Okay, so that's one thing we like you guys to sort of think about. How do I approach things from a nursing process perspective? Meaning, do I just jump to a conclusion because I see something? Or do I think about assessment? You know, do I think about ad pi, right? For example, if I said to you, your patient's blood pressure was, you know, 160 over 100, and your choices are, what should you do? Call the provider, recheck it, give them their antihypertensive, right? There's things that we need you to think about doing before you jump on that worst case scenario, calling the provider, right? If I got a blood pressure that was high and they're normally a lower blood pressure, I'm not going to run to the phone to call the provider. I have to think about, let me further assess. When did they get their blood pressure medicine last? What's their normal blood pressure? Are they in pain? So again, there's a lot that you have to sort of think about with your one patient. The next thing is, what is expected versus what is unexpected? And for you guys, you won't have a perspective on that until the first few weeks are done. But for example, if we have a patient who has an nasogastric tube, they've had GI surgery because they have an obstruction and they're, you know, nothing's moving through them. And if we don't put that tube down their nose to suck stuff out, they're going to vomit everywhere. So when we put in that tube, I expect to see sort of bilious, yellow, greeny drainage coming out of that. That's expected. if all of a sudden I walk in and I go, my gosh, there's blood coming out of that, that's unexpected. So what do I expect versus what is not expected, and how do I handle that? And the last one is my patient stable or are they unstable? Okay, you could have a stable patient who's, you know, maybe their urine output is a little bit low, but everything else looks okay. But you've got an unstable patient down the hall. Like, so where do I go first, right? I'm thinking about those things. So we have a whole lecture on prioritization at the beginning of the semester. For our semester, you will normally only have one patient. As we progress and we're at the hospital, sometimes you'll get two. And sometimes we will let you shadow a nurse who might have 7 patients. So then you have to figure out, oh my gosh, who do I go see first, right? I don't just start with bed 1, then go to bed 2, 3, 4, because bed 1 might not be sick, but bed 7, oh my gosh, like they're almost dead. I better go see them first. So that is a huge, huge focus for us as you guys move forward into nursing 112. Did that help, Grant? He left us. No. Am I the only one
Sorry,
here?
I muted myself. Yes, very much so.
Okay. All right. So I guess, Grant, we can do a couple of these questions. I think, though, the questions probably aren't as helpful anymore because I think you guys have added a lot of these kinds of questions. Yeah, so I just have a few basic test questions on here. You guys can try to write down the right answer and then.
Or what I could do is post them, Jackie, and then post the right answers.
And instead of doing it now?
Yeah, if that's what.
Yeah, that would be great. And then we could just, I think that's it for the PowerPoints, isn't it?
Yeah, I think they're all.
Yeah. Just a couple of things, guys, before I open up for questions. I will tell you that usually I have a PowerPoint that says suggestions from other students, you know, people who've gone on to do this before you guys. And what they will tell you is you need to be prepared when you come to class. Make sure you have a study group. And you might say, ugh, I don't like a study group. Well, I'm telling you right now, that might have worked in 111. It will not work in 112. Those students who did best had a group that they studied with. And you can actually use that circle in for studying in groups. Let's see, what else? Being prepared, study groups, coming to see us. If you did not do any review questions this semester, because I know a lot of students don't want to spend the money on review books, you're gonna need them. So I would try to start purchasing some review books. I have one right here underneath my desk on the floor. Let me move it with my foot. You know, like I have tons and tons of these. The experts, not me, the real experts say that before any test, you should really practice about 100. Oh, there, Grant's got one too. 100 practice test questions or more. Because that gets you in the mindset of the nurse, right? Of how do I look at this question and how am I actually putting myself in that situation? We are not going to expect that you do much in the way of 3x5 cards to write out your objectives. That works great in 111. That's a strategy for 111. It is not a strategy for 112. Writing out cards is too time consuming. There's too much. In one conference alone, we have 90 objectives. So you don't want to be, that's 3 conferences though. I see people's eyeballs going, what is she talking about? But there's different ways and we will share that with you the first week. Okay, so it's fine before you come to see us if you start writing out your objectives, but after that, we'll try to, you know, help you out with how to study better. Yeah.
And also on the note, the books, those books are rather expensive. So if you get a good study group and have one person buy a book, and that way you can share them, it's that much better economically.
Yep. Grant, this one book that I have, this is from 2011, and it's still pertinent. So if you're smart over the break, I would try to go on Amazon and buy a few older ones. I wouldn't go back to, you know, the 1990s before you guys were all born, but you know, anything sort of more current like 2011 on, that doesn't change in nursing.
Who do
We
you
also-
prefer?
What-
Which one do you prefer? Which
It's on
one's
your-
the best one?
It's on your course information sheet, the ones
Yeah,
that we want. Yep, I think, why can't I think of it?
Lippin Cat or Kaplan or something?
No, we have Silvestri that we recommend. But honestly, I don't really care whatever review books you guys have. We just expect that you're having them, because I will tell you, I've been doing this for 16 years, and when students come to me after 4 exams and say I'm failing, I don't know why. Well, how many practice questions are you doing? None. Do you have a study group? No. Are you using a whiteboard to write? People are just not doing what's expected. And I always tell students, if you do everything you're told to do by your faculty, use office hours, read the textbook before you come to class, do the notes, you can pass the course. You just have to be willing to do what we tell you to do. And I think that's just your choice, right? I get it. Books are expensive, time is limited, but nursing school is hard, guys. There's just no way around it. It has to be hard. We're taking care of people's lives. Personally, I'm extremely offended when a student says to me, I don't have time to read the textbook. Oh, well then don't come and take care of my family, right? Don't be ridiculous. That is the most ridiculous thing to say. Do you want your doctor to say that? I didn't read the textbook, but I was really good at clinical. No, right? Carlene, right? Am I right, Grant?
Yeah, absolutely.
I'm not saying that you have to sit here and read. You skim it. You see what the objectives are and you skim through the notes. We are, like I said, I would never want a nurse coming into my mother or father's room and saying, I didn't read the textbook, I don't have time. Well, then I wouldn't want you as my nurse, personally. So you got to find the time. All right, enough of me talking, because I could go on and on about 112 forever. Last thing though, before we open up for questions, I did teach in 111, so I kind of know what you guys learned and what your perspective is, and I know how you learn nursing process, and I know the math, and so I kind of know where you guys are coming from, so I think that's helpful.
Can I say something? So, I hope you guys really listened to Jackie when she told you that, that to go with the flow, especially with the outline, as the outline comes to you and you're learning a new outline, go with the flow, okay? That is exactly what we had to do in week 8, right? We had to go with the flow. And for all of those that are working in healthcare right now, or are working in places that their jobs have changed, you had no choice but to go with the flow. Don't get caught up on the outline, because guess what? I promise you, when you go into your second year of nursing, your outline's going to change again. And in your second year, it's going to change 3 or 4 times, okay? So just take it as it comes to you. There's no need to complain about why this is set up this way. You have to adapt to it. And that is the biggest thing a nurse can do, is adapt to the situation that they're in, okay? And that's what makes you be able to kind of critically think through everything a whole lot better. All right, that's all.
Thanks, Carlene. Does anybody have any questions for me? Don't be shy. What have you heard? Well, it's all different now anyway, right? What you would have heard the first 7 weeks is different than what you would have heard now.
See, they're really quiet. I tell them this all the time in clinical. I say, I put you guys in a room together and you don't stop talking. Then you're sitting in a room by yourself and you don't talk at all.
Yeah. Nobody has anything they're worried about, concerned about. Because if you have that same question, somebody else in your group probably has the same question.
Okay, I'll be the first to go.
Thank you, Megan. Good to see you.
You too. So for the skills that we didn't learn, things like IVs, G-tube, catheters, will that be something, if we're in class in the fall, will that be something that you guys take 112 time out to kind of teach us in person, or is that something we're gonna have to go to for an outside skill lab or something like that?
So you guys did the book material, right? And then did you guys have a conference though, Grant or Carlene, that you guys demonstrated any of those skills for them?
All through Zoom. It was all through Zoom
Yeah.
because that was week 8. That was the week that we switched everything, but we made sure we got pictures of our models and our task trainers and stuff like that.
Right. So they've seen it, they've heard it, they've read it, but they haven't had their what you're saying, Megan, is you haven't had hands on yet.
Right.
Yeah.
Right.
And I just want to reiterate, because some of my students, they thought they were going to be able to start IVs on patients. We cannot start IVs on patients.
No,
So do not worry about that skill. You learn that skill on the job, unfortunately.
don't worry about it. So let me say this, Megan, Nursing 112 is trying to coordinate with all the other faculty to see, is there a time, when we can get in the first week of school and kind of do some extra practicing with students. Right now, we don't have a plan because we don't know if we can get in. If we can get in the first week of school, I think it's like, what is the first date? August 24th or something?
Yeah, August 24th.
Yeah. When you guys see the calendar, we have nothing that week. We have 0, nothing. We don't have any on-campus classes. And so we are hoping that week we can set up time to have you guys come in and practice some of the skills that are super important. G-tube's not super important. Catheter, probably. Looking at IVs, blood pressure, some of those things. We won't be able to go back through all of those skills that you guys didn't have hands-on with, but we're gonna do the best that we can to get you guys with hands-on, the things that are super, super important that you're gonna see every day. You're not gonna see a G-tube every day, right? You're gonna see an IV every day. You're gonna have to know how to do a lung assessment, and we just can't reteach a whole course in a week, but we're gonna find a way to make sure that those skills that you guys definitely need are things that you feel comfortable with. So Nursing 112 right now is hopeful, but I can't send you an email yet to say for sure because we don't know if we can even be on campus. If we can be on campus, that first week when there's nothing on the calendar, we will be available for several hours, like on your clinical days probably, Tuesday, Wednesday, Friday, for you to come in for a few hours if you want. I'm not gonna make it mandatory and say, okay, we're here, what do you need? You wanna practice giving a shot? You wanna practice, looking at IVs? You wanna practice blood pressure, lung assessment, pedal pulse, whatever it happens to be. We just won't be able to do everything. But let me just have you guys be assured. We got an email from one of our graduates from, I don't know, did you graduate with Jonathan? Oh, Carlene, you graduated with Jonathan.
No, I worked with Jonathan.
Okay. So he was one of our grads several years ago. He was in a leadership position at RGH. Now he works in endoscopy, an amazing nurse. And he wrote us a letter saying that he's been in contact with many nurses at the hospital and everyone feels the same way. When you guys graduate and you are ready to be nurses on the floor, your orientation is probably going to look different than anybody else's because you were behind. Your skills just aren't where you want them to be because you didn't have that opportunity. So hospitals understand that you're going to come in with a completely different skill set than somebody who took all of 111 or took all of 112. So don't feel like you're going to be like the worst nurse ever because you missed part of 111 and you don't know how to take care of a G-tube or you don't know how to give an enema. Look,
the major skills that you learned to practice over the summer are obviously assessments because you can do that on anybody. And then also vitals. And if you don't have a BP cup, obviously you don't have one. It's always good to have. But those are the 2 skills that you can really get down pat so you're ready for 112.
And just as an FYI, you guys might learn how to do an enema in 111 or use a G-tube or things like that. And then by the time you get to us, we got to look it up anyway because you completely forgot how to do it, right? Because you just did it one time. No expectations that you have that down perfect. So we're going to do the best we can, Megan, to help you guys feel a little more comfortable with the skills that you're feeling uncomfortable about and the ones that we know we have to get ready because the hospitals expect it. Okay.
And a major hurdle that you may be afraid of is the medications, because they do them so much different in a hospital than they do in the nursing homes. And 112 already knows that, so they know how to walk you through that. So don't be nervous about that. Just know your meds when you look them up in the morning.
No, but they have the pharmacology workbook now. I sent it to everybody. So there were instructions with that pharmacology workbook. Here's your summer work, right? When you come to that first week on campus, not the first week when there's nothing going on, but your first clinical day, that workbook needs to be completed. And the reason it has to be completed is when you get to the unit and you're ready to give meds on your patient. Let's say Grant is my student and he's going to give meds to 56B and he's got 5 or 6 pills to give. Well, guess how long it takes Grant to look all that up on the spot? Oh, long time. And we don't have time to wait. We're just in a hurry everywhere we go. So we have given you a booklet of the most commonly used meds that we see in Nursing 112. So for example, if Megan is going to give meds with me, she's already got her booklet ready, we can go give meds and I can say, okay, Megan, tell me about low pressure. And she can go to her book and look it up. She doesn't have to take the time to go to the computer and do it. So the expectation is that workbook is completed.
And you have the workbook from 111, so, because those drugs will still be in the hospital. So, you know, those workbooks are good.
And those are still testable, those 111 meds. So you want to make sure that you bring that because that is testable content for you guys as you move forward. We don't often ask you like a ton of med questions from 111. Labs, yes. Assessment questions, yes. Things that you learned, but not minutia, you know, not little picayune things. We have too much in our course to teach you guys to be going back and asking a lot of 111 content. So.
Any other questions from anybody?
Can I ask you a
Jackie.
question about, oh, go ahead. Sorry.
I just was,
Molly,
hi,
yeah. Who's asking? Molly?
Molly, yeah.
Okay.
So aside from the pharmacology workbook, do you have any other suggestions of what to do over the summer?
I would say, just as Grant said, if you have access to any way, shape, or form to do blood pressure and pulse, if you can practice that or watch it if you don't have a cuff at home, that's fine. I'm not saying that you have to go out and buy one. But normally speaking, when you come to 111, if you had been on campus or when you come to 112, if you had been on campus instead of in this COVID crisis, we would have expected you day one, you better have your vital signs down because we don't have time to go through that, right? That was a skill you guys, we know that's not going to be the case. So if you can do that, I would also say as soon as the outline becomes available for you guys, and we'll let you know, I would say getting started on some of the reading. And in past semesters, I'll check with my team. We may very well be able to send you the readings for the first couple, for at least the first week, so that you guys can get some of that stuff done ahead of time.
And there is a new book that you have to buy, the Lewis
textbook, and that book will take you, well, there's actually Lewis and Hockenberry. That's our pediatric book because we start in 111, we start with peds as well, or 112. Those two other books though will carry you through 214. You will use both of those in 112. Not so much in third semester, but you'll use them in 214. No, try to get whatever version we tell you to get. Otherwise, material could be old and outdated, and the page numbers aren't going to coincide. So, good question. Was somebody else going to ask something?
You answered my question about the material for next semester. Thank you.
Yep, you're welcome.
And you do not have to buy another bag. What you bought this semester has the stuff you need for 112 in it. So just save that.
Yeah. And just as a reminder, and I would imagine that 111 told you guys this, we do not accept my work lets me fill up my bag and take what's at their hospital. Nope. we're going to send you away and make you go buy one. That is stealing from the hospital, and we do not allow it. So if you come without a bag, you're going to have to go buy one, or you're not going to be able to practice the skills. And then that is an expectation. So please make sure you get the bag. Okay, if you don't.
So what if we used our masks from our bags for the pandemic?
Oh, Megan, that was smart. That was critical thinking. Don't worry. Little things, because sometimes you guys will go in your bag and it will be like, ugh, I don't have this, or I used too much. Little things we can get for you guys. So don't worry about that. Who knows who's going to have masks or what the scoop is going to be, but we'll probably be able to manage some of those smaller things. Oh, that was smart of you. Did you guys all take your masks out of the bag and use them? God, I never would have thought of that. That's fabulous. Everybody's going to their bags now, Megan. Good idea.
Deplete them.
What else? What else, guys? Anything? So if someone could just let me know, or thumbs up, thumbs down, or hand in the middle, are you feeling a little bit less anxious about next semester? I mean, at least we're not horrible human beings. We're very nice. We're very kind. We're patient. We're a little bit of a crazy mess in 112. We're kind of like a, whatever. But you need to follow the rules. You need to get the homework done. There are no excuses. You know, those sorts of things that we would expect with anybody who wants to be a professional, right? You guys chose to come to nursing. We're super excited that you're here, but you got to take the work that goes along with it. The one thing I don't ever want to hear is that, so you're trying to trick us. That's tricky. It's not tricky. We're not trying to trick you guys. And to me, that's like a dirty word, tricky, right? We're trying to ask you questions that you would see similar to on NCLEX. So we're just really trying to prepare you. So I don't like to hear that's tricky. And I don't want to hear how hard it is. I know. I went to nursing school. It was hard for all of us, right? I will sympathize with you, and I will give you a hug if you need it, and I will help you. But don't tell me how hard it is. Let's just figure out what to do. It's hard. It's hard, people. How many times do I have to say that, right? It's hard. Let's just figure out how we can make it seem less hard for you guys. Okay? There you go.
And Jackie, if you're in her clinical, she bakes a lot, or conferences. So
I'm a big, and in fact, at the end of the semester, my students usually, we do a big party. I'm on 2800 at RGH, which is kind of a GI surgical unit, but we get a lot of general surgeries, but the nurses are amazing. And so at the end of the semester, my students, we do a party, but nobody else is helping me to do the party this semester because they can't go out. So I'm starting up my baking now when we're all done, and I'll bake a bunch of stuff and drop it off on 2800 tomorrow for my staff. So yeah, so I love to bake. Who's in my group? What? Oh, all right. Is it Selena? Selena? Is that right? Okay. Who else is in my group?
I forgot I was on mute.
Amy.
Megan. Okay, good. Faith, are you in my group? What?
Unmute Faith.
Oh, Faith, you're talking. I can't hear you.
Peter says he's in your group.
Yes, yes.
Oh, very nice. Excellent. Well, let me tell you, you're in for a treat, people. We have a great time, but don't come with the wrong earrings on. Don't come with a crummy unit. Like when I say I'm a rules follower, I'm a rules follower. I don't care if you have 50 earrings and a nose ring, but there's a policy. And so we have to follow that policy, because if you break the policy with me and you go to third semester, guess what happens? Third semester comes to me and says, why are you letting them? So follow the uniform policy, do what you have to do, and we'll all be fine. It's a fun semester, I think.
The material's so much more interesting.
Well, of course I think that, but you know, that's just me. I thought 111 was interesting when I taught it though. You know, it's that first, like, oh my gosh, I'm gonna be a nurse, yay. And then you get to 112 and you're like, okay, I'm gonna be a nurse, but now it's just more work, right? And clinical starts at 6 a.m. Who's excited about that? Thank you, Molly. Thank you. I am up at the crack of dawn, guys. I'm an early morning, 4:30, 4 to 5 person, and but don't bother me after 7. You don't want to
looking
talk.
forward to more schedule.
What did you say, Molly?
I'm looking forward to being back on a schedule.
I know. So all we can do is just hope. We have no clue yet. We're making a whole lot of contingency plans, like maybe we can be on campus with smaller classes. Maybe we still have to Zoom our lectures. But we're hoping that we're all going to be together, because this is just so not fun. I love my husband. I love being home. I love having on my yoga pants. But I miss that connection with all of you guys. I miss it. And, it's nice to do this, but it's just not the same. So yeah, ready to get done with this. But I'm also excited that the semester is almost over, right? Yay. Tuesday, right? Next week, you'll be done. Are you guys morning? Oh, what time are you guys doing your exam, Grant?
Tuesday.
At what time? Good morning.
8 o'clock.
8 o'clock. 8 o'clock.
8 o'clock?
And
Yay.
also just a reminder to everybody that there are clinicals this week. You are expected to go to your clinical, because there's been a few students that didn't think we had clinical, but we do, and it's going to be counted. So make sure you go on your clinical either Thursday or Friday this week for your last student conference.
Right, and if you did schedule your HESI during your clinical, that's okay. Please do not reschedule your HESI. Just let your clinical instructor know, okay? We do know if you actually are scheduled at that time, so it's not your excuse to get out of clinical.
Oh, Carlin, I just rescheduled it today.
You just rescheduled it, man?
Email, yeah. I don't know. I was gonna do it today, but I guess I couldn't. I have something to do, so I rescheduled it for Thursday.
Oh, okay.
Well, you got a great group coming in, Jackie. So.
I'm excited. I mean, 68 is a little overwhelming for us. Like, we do pretty well with 60. We have to get in, which means we'll now have to overload our classes, and we have to get one more adjunct. So it's a little bit more work for us, but that means you guys are a good group of students who worked really hard to pass. And that's what we want, right? We want, if 68 of you want to be a nurse, let's get 68 of you to guys be a nurse. So I'm happy it'll be 68 new friends I have instead of just 60. So I'm excited to see you guys. If you have any questions, you can email us. I will be the course coordinator, but I'll be training Mary to be the course coordinator with me. So if you have questions, you can email both of us, or you just want to email me, or you guys all know Liz, right? Ay. You guys know Liz, that crazy creature that she is, my buddy. So if you guys want to email any of us, that's perfectly fine. We'll get right back to you. What else am I doing? Nothing. So if after this you go, oh my gosh, I had 3 questions, but I was embarrassed to ask, just send them off to me. That's fine. Okay. All right. Thanks for having me, guys. I look forward to seeing you face to face, right? Fingers crossed, in the fall.
Thanks,
And we'll be in touch. Last thing, guys, please check your Outlook accounts frequently, because we could find out in June that this is going to be the plan, and we have to might have to start making, some ideas about that. So please, when you come to 112, we expect that you're going to check your email every day, just like you do for work, right? I mean, that's a professional behavior. So please check your emails and respond when we send something out. Okay, that's it now.
All right, everybody. It's
thank you,
been
guys.
Good kind of seeing y'all. And we wish you the best of luck in the future.
Thanks, Grant.
Thank you.
Thanks,
Grant.
Hey, guys.
Thanks, guys.
See everybody. I'm glad everybody still has a face. Love seeing you guys.